It's what some are calling a broken system. For those with government-run health insurance like Medicare and Medicaid, finding proper treatment for an eating disorder can be difficult. WRTV's Nico Panisi explains one Wayne County family's story.
This is 26-year-old Brittany.
She went from this to this.
She has high-functioning autism and last year developed anorexia nervosa.
We were constantly pleading with her, just eat, and it seems so simple to you and I, but for someone like Brittany, it isn't.
Mom Tina Johnson says she desperately needs an inpatient facility. That way she could be monitored 24/7. The issue?
They all say they can't accept her insurance.
Brittany is on Medicaid. Johnson says many places don't accept her insurance. And she says the out-of-pocket costs can be upwards of $1,000 a day.
They like to, at least keep them for a minimum of 30 days. There's no way. That's just ridiculous.
Johnson and her daughter are not alone. 96.7% of ED specialists believe patients are put in life-threatening situations because of health insurance companies' refusal to cover treatment. And that's according to an Eating Disorder Coalition survey of 109 specialists from nearly every inpatient facility nationwide.
When you have comorbidities, especially being low income, there is this rift with insurance, especially those that are on public assistance, of what is going to be covered.
Michaela Dowell is a peer mentor with Equip, a virtual eating disorder treatment program. Dowell says situations like Brittany's are all too common. Advocates like her want to see the system change.
There's a cost minimum, right, per an individual that's on public assistance in each state. Now, depending on what state you're in, right, the cost is going to be different, right? I would say that cost needs to almost be removed.
For Johnson, she fears for her daughter's future.
Her body is just going to start shutting down, and that she will eventually pass away. That's our biggest fear.
That was our Nico Panisi reporting. Now, people have recently been voicing a lot of frustrations with the health insurance industry, and it follows the recent murder of the United Healthcare CEO, which is the largest health insurance provider here in the U.S. We do have more information about the recent developments into that murder case that's coming up here on the news at 11.